nursing is sort of foundational, being able to take care of people. I didn't want to do things that I didn't have a passion for. I did some brand ambassador stuff and promo modeling, did events, and I did that for a little bit. And then I said I wanted something more consistent. I applied at Baylor since it was down the street for the nursing school. And so that's what I did. I get to do all the things that I love, still do surgery and work in aesthetic, put the nice finishing touches on people and help them feel good about themselves.
Welcome to Beauty Unveiled. I'm Dr. Sturm, and today we have something very special for you. We are going to introduce you to my team. Hey.
Hi.
I'ma kick back when you fake like that. Back when you fake like that.
And here we have Keisha Davis. She's a wonderful aesthetic nurse. She does injection, she does lasers, she does facials, she does all of the things. We met in the Methodist OR.
Yes.
And you came to help me detangle someone's hair, which was very much appreciated.
But I love that. I love that. I think that's what drew me to you, is you actually taking the time to clean someone's hair and make sure that it was good for post-surgery.
Yeah, and that they would feel good and they wouldn't wake up with,
blood,
stuff in their hair. Yeah. Hopefully you'll still feel like you've had surgery, but a little bit less. So.
At least you don't have to look like you've had surgery.
Right. And I appreciated that about you, that you saw that for the patient and wanted to jump in and help, and, which you always do. So.
Absolutely.
So tell us about you, how you decided to become a nurse, how'd you get here?
It's definitely been a long road for sure. Nursing is my second career, I guess you can say. So I just knew that I wanted to be in the medical field. I wanted to help people. And kind of after living my life, and traveling and doing all sorts of ends and odd things, I decided, hey, you know what? I wanted to do nursing. I thought that nursing would give me a great foundation to be able to learn about people, learn about taking care of folks, just the medical field in general. You know that nursing is sort of foundational, being able to take care of people. And so I started to pursue that degree, and I was in nursing school, and we had clinicals every semester, and we would have a day that we would do surgery. We would be in the OR. And so being that this is my second career, I didn't want to do things that I didn't, have a passion for. And so just being exposed to surgery, made me kind of go into that route. So I applied for all of the OR jobs that I could, and people would tell you, oh, do med surg, blah, blah, blah. So it's not for me. I don't have time to play games. So I applied and got in. And so I kind of, got into plastic surgery. We did a lot of reconstruction. And so that kind of, opened up my eyes to the more artistic part of surgery, right? And being able to still help people and make them, feel good about how they look. Yeah. And so that kind of led me down the path to aesthetics. And so here I am. I get to do, all the things that I love, still do surgery and work in aesthetics to kind of, put the nice finishing touches on people and help them feel good about themselves.
Yeah. I feel like surgery is one of those things. Either you love it or you don't. You're like, this is the coolest thing ever, or like, I'm hungry and I'm cold and I want to go sit down.
Absolutely. I've found it fascinating just being able to, I don't look at it as like guts and gore. It's definitely in some parts controlled, of course. Sometimes it can be a little gory, but I was never, really antsy about it. I was fascinated, especially, in the learning process. Some of the doctors were really cool and be like, hey, like put your hand, in the chest, you feel the heart, all that good stuff. And so, it just kind of made me fall more in love with surgery. And now I've kind of just broadened my horizons into the whole thing. So I was like, I get to do surgery one part of the week and aesthetics the other part of the week.
Yeah. So what did you do before nursing?
I mean, I can't really say like there was a thing that I did, consistently all the time. I went to school. I thought I wanted to do something. And then during the summer, maybe between like my junior and senior year, I was like, I don't want to do this.
Yeah.
I don't want to do this anymore. And I was like, but I'm like so far in. I was like, I finished school, but then afterwards I was just kind of like winging it. So I did some brand ambassador stuff and promo modeling, did events. And I did that for a little bit. And then I said, I wanted something more consistent. And it just happened at a gig. Someone that I met there was saying, hey, I mean, since you want something more consistent, you could work at this fine dining restaurant. And I was like, okay. I was like, if I'm getting paid hourly, why not? And so I applied and got the job that day and started like the next week. And, learned all about fancy food, and wine and, people having to wear jackets and can't come in with shorts and all this stuff. And so kind of had my hands in all the happenings, especially because I worked in downtown Dallas and people would be coming in for conferences, and business and stuff. And so, we had relationships with the nearby hotels and, the concierge would call us and be like, oh, what's going on in town? That type of stuff. So it was fun, but I was with a small restaurant company, I guess you can say. So they had a couple of restaurants in the downtown Dallas area. And me, I love growth. And so after a while, I just felt like I kind of hit a glass ceiling. Yeah. And so I was like, you know what? I was like, I have played around long enough. And so I really need to get back into pursuing, what I wanted to pursue, which was medicine. And so, I don't say it was like on a whim, but usually like once I've made a decision, it's like full throttle. Yeah. And so, I just started applying for programs, and I applied at Baylor since it was down the street for the nursing school. And so that's what I did. I did that. I worked while I was in school and eventually, graduated, and I'm still friends with those people. And it was definitely a great part of my life. I learned a lot between managing and interactions and hospitality and customer service. And so I've definitely taken a lot of that into dealing with patients and interacting, with surgeons and staff and all that stuff. So it was definitely a part of my life that I learned a lot from, and I appreciate that I'm not there anymore. But it was definitely a learning experience, and I'm glad that I did it. So it made it, the route here a little bit longer, but everyone's route is not the same. So it definitely helped me to mold, who I am now, and definitely gave me the growth that I needed to kind of, interact in my job today.
I feel like the service industry does teach you a lot, dealing with the public, dealing with people and good and bad days, and providing service, because
exactly
the people that go into medicine with none of that background may present things differently to patients and to physicians and stuff.
For sure you have to, I wouldn't say like put on, but you have to be able to navigate all the different characters, all the attitudes, putting on a brave face and being able to, handle regardless of how you feel. So it was definitely helpful.
Yeah. And even in plastics, medicine
it's the plastics.
Facial plastics are a little nicer.
Right.
Sometimes.
Sure. I mean, you're
depends
nice.
on which
you're
ones.
Nice. Yeah, you're nice, Dr. Sturm. Dr. Sturm is nice. It's the others.
Yeah, some days are easier than others. And, in medicine in general, I think some days are easier than others. So it takes an emotional toll. I hate to say toll, but kind of. I saw something by somebody, I forget what they were saying, and it is emotional. Because even when what we do, you're listening to people's story and you're talking to people and you're hearing their concerns all day. And even if it's not a negative thing, and even if no one's complaining, it still emotionally takes a lot out of you to like listen to someone else's worries and concerns.
Absolutely.
And, you know, like you said, you got to like shake it off and go to the next one because, you know, you're here to help someone feel beautiful and wonderful. And, you know,
and they want to feel like you are focused on them.
100%.
They are the it person for you.
Yeah.
And so it definitely, like, sometimes I was like, don't have the energy for this. I don't have, you know, and sometimes I have to mentally prepare myself for the day. So be like, okay, you got this, girl. Let's go, you know, and tackle. And then it's like, once the shift is done, you're like, okay, you know, like there's a relief, like you're tired. And sometimes it's really about the mental stuff. It's, you know, like physically, okay, sometimes you might have a busy day, of course, but honestly, I feel like the mental stuff is the most draining.
Yeah, I agree. It is for me too. Like physically, that's a lot that goes into it, but being able to like decompress, you know, from the day is huge because, you know, you're focused on one thing or one person, you know, very intently for a very long period of time for surgery and for injections and for, you know, but it's rewarding. You get to see people happy and
absolutely,
you know, feeling
you're like,
good.
you know, I did that. I helped
I
them
know,
to get there.
Like, that's
so
part of that. That's
Yeah.
It is. It's exciting. So what's your favorite thing that you do in aesthetics?
That's a hard one. So I really like to do a lot of skincare stuff. You know, I'm kind of big on that.
What's your favorite product? It can be anything.
I like Alastin products. I think HA is a big thing that I really like. I know people are like, oh, sunblock or whatever. You know, I'm like, you can't put sunblock on trashy skin and think like that's gonna make it, you know, make it work. Exactly. So I think I'm
protect the trash.
Exactly. It's like, come on, guys. So I think, you know, like having moisturized skin, you know, like your skin, it doesn't look flaky. You know, you can have some actives and stuff like that, but just between like hyaluronic acid and moisturizer is a big deal. Maybe throw in a little bit of vitamin C in there. I like that. Skincare I think is big. I like doing Hydrafacials. You can have a little glycolic acid in there, you know, do a little exfoliation. We could even get a little microdermabrasion in, but it gives that nice glow afterwards. And we've cleaned your skin out, giving you a nice restart. And then you like look nice and supple, you know what I mean, like baby fresh. And then I like doing injections. I think it's definitely a cohesive type of thing. So you have done your skincare and then you can get your Botox, and that makes, you know, the effects last longer. We can, you know, prevent the wrinkles from coming in. I know people can be expressive. I, for one, can be expressive. I have to like do the thing. Shout out to Dr. Hillquist, you know, getting my face together. But you put all these things together, right? So your skincare, having some neurotoxin on board, and then you can do, you know, some treatments here and there, and you can be that nice 80-year-old lady looking snatched. It's the new 50, right? And so it's like all the things kind of work together to make, you know, a person look good and feel good. So skincare for sure. Some Alastin products. Dr. Sturm has some amazing products as well. Get a little retinol in there. Love your moisturizer. And then do some neurotoxin treatments if you want to plump up some stuff. I know as we age, we kind of lose some fat and everything like that. So you can do some subtle enhancements with some fillers, and then do your treatments, chemical peels. You can do some micro needling, and then some lasers to help with dark spots or little red spots, to kind of make everything smooth on out and look nice.
Awesome. A little bit of everything.
Yes. I know. It's supposed to be my fave, but as like you just kind of snowball into the things.
For sure. Well, thank you for spending your time with us and telling your story. And
thank you for having me.
Yeah, I appreciate it. And you can come see Keisha here with us, get your injections and your whole plan.
Exactly. I'd love to help you.
Yeah.